Once you become a mom, it can be hard to find that me time to take care of yourself. Always putting your family before yourself is what most of us do, but that can really take a toll on both our mental and physical well being. That's what happened to Tracy, our first Monday makeover candidate for the day. Once her kids got to be independent enough, she challenged herself to lose more than 30 pounds. And then she got the true mommy makeover from Dr. Julene Samuels. Style contributor Christine Fellingham has the details.
Hi, I'm Christine Fellingham, and I'm here at the beautiful offices of Dr. Julene Samuels out in Norton Commons for another Monday makeover. Dr. Samuels, thanks so much for being here again today.
Thank you.
Today, we're talking about the mommy makeover. Having children can kind of do a number on your body, and I know women come in to see you for a variety of issues that kind of are a result of that. Tell me what a mommy makeover means to you.
A mommy makeover is usually where we're combining breast recontouring with trunk recontouring. So many women after pregnancy feel smaller, saggier. Their tummies obviously have gone through some changes. So sometimes it's an implant-only procedure with liposuction. Sometimes it's implants with a lift, sometimes a lift or a reduction and a tummy tuck. So it can be all of those things.
I know with you, a tummy tuck is something a little more detailed and it gives a really nice contour to the body. Can you tell me about that?
Yes. So obviously the breast and tummy are one aesthetic unit almost. So I think the combination done together is very powerful body change for patients. But the kind of tummy tuck that I do involves tightening of the anterior skin, the muscles, removal of the fat below the abdomen, surgically removing it. But then once that is sewn up, to create a really nice waist viewed from either the front, the side, or the back, because we see the trunk circumferentially, I will do some pretty significant liposuction of the back fat and the waist if someone needs that. Obviously, if they don't need that, it can be less liposuction, more skin and muscle tightening.
So they get that beautiful kind of hourglass curve
Right.
back and not that kind of a blocky look that's just...
They don't lose their waist. The old tummy tuck did not take out skin enough to create an hourglass waist. There was not liposuction ability at the same time as the tummy tuck because of the blood supply reasons. But also when you deepen the waist, it really changes the contour of the waist to the buttocks, and it makes the buttocks almost look like you've lifted them.
Well, we have the perfect example of all of these benefits over on the chair here. This is Tracy, and you've come to talk to us today about your incredible experience with Dr. Samuels.
Yes.
What brought you in, and what was your experience like?
Well, I have 3 children and had wanted this for a very long time, and just finally decided it was time.
Now, I know you really had worked hard to get yourself into shape for your surgeries. You lost 30 pounds.
Plus, yeah.
You look incredible, but talk to us about what surgery did for you that just weight loss and exercise couldn't.
Well, you know, when you lose that much weight, your skin just doesn't cooperate. And, you know, I had this pouch on the front of me that needed to go. And I, you know, debated it for a long time and was scared of the pain, scared of the expense, the downtime, all those things. And had I known, I would have done it years before, because it was not all the things that I anticipated.
Our kids ride horses together,
Yeah.
so we are also friends, and her recovery was amazing. And I think your attitude about what you needed to do to be healthy, but also giving yourself some time to recover.
Right.
The pain pump, that helps people be
Absolutely.
ambulatory and moving around within a week. The night of surgery, you know, we have Tracy out of bed and
Right.
starting to motor around. So the patient's attitude about all this and wanting it like Tracy did, being motivated, and that's incredible for healing.
And I think a big key is getting as far as you can first, getting the weight off, getting the fitness, getting all of those things set is key.
That's important for
to the
safety.
satisfaction.
It
too.
improves the single
Yes.
step result, but it is so important for safety.
Yes.
Blood loss, low risk of blood clots, and just a faster healing because you've timed it well with the change that you're about to make.
So getting yourself in shape first gave you a better result and a better recovery time.
I feel like absolutely.
Improving safety.
So the two of you really worked well together.
Well, we have to forge a partnership.
Right.
It's a partnership. I make the recommendations, but the patients have to hear that and they have to cooperate and want that and do what they can to smooth their recovery. And it's a huge help when you have a patient like Tracy who's all in.
Well, the results speak for themselves. Thank you so much for sharing your story today, Tracy, and Dr. Samuels for sharing your, as always, brilliant advice. We appreciate it. Thanks again for watching us on another Monday Makeover. And if you have a friend who would love a makeover, please go to the Great J Live Facebook page and share their story. We'd love for them to be next.